Welcome to North Star Physical Therapy Podcast. I'm Dr. Shirley North, and with over a decade of clinical expertise in the areas of pelvic floor conditions, lymphatic conditions, and chronic neurological diseases, I have a wealth of medical knowledge that I want to share with you all. In this podcast, I will answer the most common questions I receive from clients, family members, and fellow clinicians. Our purpose is not only to answer questions, but to educate you so you can make the best decision for your optimal health. This podcast is perfect to listen on your way home from work, while you're on your daily walk, or just taking 15 to 20 minutes for yourself. Again, welcome to North Star Physical Therapy Podcast, and get ready for us to guide you to optimal health. Hi, and welcome to North Star Physical Therapy Podcast. Thank you for those who are continued listeners, and welcome to those who are newer. So in this podcast today, we're going to get a little technical. We're going to get to a bit of a pain point when it comes to physical therapy landscape now, especially within the specialties of pelvic health and lymphatic health, that, as you know, I specialize in both. And so the topic today is going to be out of network, right? When a provider doesn't take your insurance, especially within pelvic health and lymphatic health. What is that? What does that mean? Is it better? Is it worse? Like what does that really mean? I find being a provider now for 15 years, which is crazy to say, but I have seen a lot. I have seen not only just like the normal clinical day-to-day, but then also being a clinical director for years, as well as now being a business owner. You see and are exposed to a lot of the behind the scenes stuff. And some things I think within the current landscape of our healthcare system here in the United States has been made more transparent. And it's a frustrating point, to be quite honest, of how we run things here in this systematic BS that we have to do and be such an advocate for ourselves, our own health, when that's not what the intention of all of this was for. And so a lot of specialty providers, and now you're seeing more and more primary care providers, internal medicine, the more kind of like general providers become more and more of this concierge or this out of network option, because they are so limited by insurance mumbo jumbo that it is a huge strain on the provider, which is not the point. The point is to make sure, yes, we're well documenting, we're doing things so you can get the coverage you deserve. But a lot of the insurance companies hold on to that premium, and it never gets to the provider. All right, so I'm going to kind of explain a little bit of what happens when you go to an insurance-based provider. And again, I'm going to specifically speak upon physical therapy, and specifically within pelvic health and lymphatic health. But some of this stuff can be generalized to other providers. So definitely like research and like ask. But I want a general understanding, because this is something that I talk about every single day with people that are calling in to seek, that are seeking services from me, and why a lot of us are going out of network. Now, a lot of insurance providers are understanding that, and they have out of network benefits. If you're able to sign on board to a plan either through your employer or through like the state program that you live in, and they have out-of-network benefits and it works for you, do it, because a lot of providers in several specialties are out of network. We're just now seeing more and more of that happening within physical therapy and like primary care services. We know a lot of our colleagues within the mental and behavioral health space have been doing that for years. It's such a specialized thing, and some insurances are finally kind of picking up on that benefit. But even with having insurance being like in network doesn't mean it's better. Okay, so being out of network means the provider is not obligated to any contract with the insurance company. So oftentimes when you become in network, the clinician has to be credentialed or like certified with the insurance company, and they agree to an amount of payment from the insurance company to the provider. Okay. Now, that payment typically is a contractual allowance, right? Is a contracted amount that the provider has to fight, for as much payment as possible. But they understand, oh, there's going to be a demand supply, kind of thing. So if they have a lower payment, but they're going to get a whole bunch of clients from this insurance, it kind of help like offweigh, some of that. But typically insurance providers are the ones that set that rate. And the provider really, really has to work really hard. And oftentimes they're denied, and oftentimes it's a much, much lower rate. For physical therapy specifically, our rates are based off of some physician fee schedule, which I think is the biggest load of BS, because the physicians aren't doing this. We are doing this. So somehow we're still being dictated, even being doctors in our field, we're still being dictated by what physicians do. But that's a different podcast or soapbox. The physician schedule is based off of like codes, right? So you see like medical codes and treatment codes. All of those numbers are all the mumbo jumbo bullshit that providers learn through school and through clinical rotations and all that kind of stuff, and through the billing department of their in-network place. But those codes are associated with some price. So if the provider is billing a certain code and a certain amount of time associated with that code, that's what factors into the overall payment. For example, if I am doing manual lymphatic drainage, I am billing a manual therapy code. Makes sense, right? Okay, cool. So let's say I spent an hour doing that. That's about, in our medical terms, about 4 units. Every unit is about 15 minutes. So 4 units worth of a manual therapy code. There's 4 units. So each unit is associated with a dollar amount, and that dollar amount is stupid low for the amount of skill set that's demanded on me as a doctor of the field. There are some of these codes that I'm only going to get paid, and not just me, let's say that corrected, the practice will only get paid about $15. I think the biggest or the most that we get paid per code is about like 38, and it really is also state dependent. So let's just confuse this shit even more. There's code dependent things, there's state dependent things, there's time dependent. And so this is all a big like mathematical gymnastics thing for the practice to get reimbursed for those services. But the price it costs to get an employee, for all the overhead costs and the amount of time is being spent from the billing department to submit these claims for you, to fight on your behalf with the insurance company, to get back some stupid small contractual allowance that barely pays for the provider that provided that services in the first place. What is the point? Right? Therefore, over time, you have seen these in-network providers now are seeing a shit ton of people at the same time to help offset those low reimbursement codes. Okay, so the frustrating point that everybody tells me is like, yeah, I'm sick of like being seen at the same time as like 3 other people, or like I only saw the therapist for like 10, 15, maybe 20 minutes max, and then pass me off to some machine or some aid or whatever. And that's the business part of our healthcare system, unfortunately, is that the quality of the care is not being taken into consideration. Now, there are some, like typically hospital-based programs that have a ton of insurance in network. Okay, fantastic. But then they offset their charges of things, especially if you haven't met your deductible yet. So let's say you're in network and you go to their in-network, place, they charge you just the copay, whatever that may mean. Us being specialists, typically it's a little bit of that higher copay amount, but again, every plan is different. You go, you pay your copay right then and there. Understood. That's a cheaper thing. You see your therapist, but they are typically seeing maybe another person at the same time, or they only see you for a little bit, then they jump off to the next person. They may come back just to kind of see, and then jump back and forth. So there's like a lot of jumping back and forth, not a lot of kind of one-on-one hands-on care. And we know this because I know those people, and they're just stuck in that system because they're not willing to go start their own practice. Again, different story. They come in, you do your copay, you have your treatment, but it's early in the year. And that's why I'm doing this podcast now for April. A lot of people haven't met those deductibles yet. But what may happen is that you may get a bill months down the road. If your deductible wasn't met at that time, they will then now charge you a cash pay rate, which is typically at least double, if not triple, the amount an in-network person would be, because they're trying to offset the cost of the volume and the lower in-network contractual allowance. Did I just blow people's minds there? How many times has that happened to you? It happened to me even with one of my son's physicians, that all of a sudden 6 months later, I got a bill from all of the stuff that wasn't paid yet at the time of service. Deductible wasn't met, so now I had to pay the cash price. I mean, it was absurd, right? And that's not your fault. And you thought you had in-network, stuff, but your deductible wasn't met. So a lot of plans now have these high deductibles. So if you're going to be spending the money anyways to meet your deductible, I'd much rather spend my money right the first time with a good clinician that can resolve my symptoms, and that way it's good for the rest of at least the year, if not forever, right? If they're a good clinician, they'll help you solve it for good, rather than being stuck, being a cog in the cogwheel, the insurance-based system crap. So being out of network as a provider, people can also sense that. You walk into those offices, the temperature's it's not super stressful. They tend to have more nicer environments. It's more calm. People are being seen one at a time, hands-on care. The staff also know more. They're trained better because they have the time to do that. That time, I think people are really wanting that time, that one-on-one with not only the provider, but also just a nicer office staff and behind the scenes things. And things are just a well-oiled machine. It's palpable. You can feel the difference when you go into an out-of-network provider office. And that's what makes it so different. So yeah, you get what you pay for kind of thing, right? Now, I don't want to poo-poo all pelvic floor, lymphatic therapists that do take insurance, that are in network. They are absolutely needed for folks that are limited, and that's wonderful. But you also need to set an expectation of what that visit's going to look like. And so that's what I have a daily conversation on. Seriously, almost all of people that are calling in, we are very transparent. We show you, okay, what it's going to look like to work with me versus in a network, so that way you can make an informed decision for yourself. Almost all of the people that decide to go in network, I always say, hey, we totally understand and we get it. I want to let you know too, and advocate for yourself, that if you do not have any kind of symptom change within the first 3 sessions of your in-network provider, you need to call us back because they're not doing what you need them to do. And oftentimes I get people that came from other providers that were in network, and either they said, oh, they just stuck with external things and didn't do any kind of internal work for pelvic health. I was with an aide. I was like kind of tossed around. They helped like a little bit. There were some exercises, but like nothing really changed. Like, I get this all the time. So we know what's happening. Also, they tend to have a super long wait list. And so if someone is in pain or they have an exacerbation of symptoms, the last thing you want to hear is you have a 3 to 4, 5 month wait list. Like that's not okay either, because those symptoms are just going to get compensated and potentially worse by that time. Not the in-network provider fault. I totally get that. It's just the system that they're within. And unless they're going to grab the big girl panties and start their own business, they're not going to do it. There's also when you get a client, you go through, your services for the day. In an in-network place, that like billing and all that, there are whole separate departments that's all they do is talk with insurances and fight for you, which sounds really great. Ooh, that's convenient. I don't have to do it. But then it goes months and months and months and months. And if at that time of service their deductible wasn't paid, you're still going to have to pay it. It's like, it gets really crazy. It gets so far behind. And then there's constant denials. Because insurance companies, their whole job is to deny. Right? Their whole job is just to pick apart any note, any documentation of, ooh, they didn't say the right word, so we're going to deny that claim altogether. I shit you not. There are definitely times when, for the lymphatic therapy, that there were, for a good chunk of time there were certain insurances that if I used the word trunk versus abdominal, they wouldn't cover. Are you kidding me? Right? Do I need to literally have a thesaurus out when documenting? That's absurd, right? It's the same area. Your trunk, your tummy, your abdominal, same area. The fact that I didn't have that, or there was the wrong word that wasn't it was insane. It was absolutely insane. And so that's where I work for my clients. I don't work for an insurance company. I refuse to have somebody behind a desk who has no medical training telling me how to do my job, or telling me that you only have 3 visits to fix Susie Q from her chronic 20-year history of pelvic pain. You are out of your effing mind. You cannot tell me that. And that's where a lot of times people ask me, oh, about how many sessions will this take? Quite honestly, I don't know. And it's really unfair for me to give you a rough estimate over the phone when I haven't assessed you. And we don't know how your body is going to respond to some of our treatment. Some people respond better to manual stuff. Some people respond better to external things. Some people respond better to internal things when it comes to pelvic health, for example. For the lymphatic stuff, some people respond to one kind of compression garment. Some people respond better to mobility. Everybody is different. So that's why I'm always honest too with my folks, that there is phases of treatment of working with me. And depending what phase we're in, that dictates whether frequency and all that kind of stuff, not some insurance company behind a desk. As a physical therapist who worked for a long time with the neurological population before Medicare even came out with the whole maintenance therapy stuff, I was always getting, our claims were getting denied all the time because we were saying maintaining. If it was a progressive condition and chronic condition, we want to maintain things. We don't want exacerbations to happen. And so I would be submitting paperwork after paperwork. I'd be on the phone doing what's called peer-to-peer reviews, which are an absolute bullshit that people have to do, healthcare providers have to do, that a quote-unquote peer on the other side working for the insurance company is asking me clarifications on my notes and stuff. It's absurd. It is meant to be absurd to the provider, so the provider just stops, doing it, because our time, we'd rather spend it with you and not fighting with the insurance company. And half the times, those peer-to-peers aren't my peer. It wasn't another physical therapist. It wasn't even a physician. It was somebody else that just got a job, which no fault to them necessarily, but that's their whole point. And so now there are more and more physicians that are getting on social media that are showing you. There was a physician, I just saw this video the other day of she was documenting and videotaping the peer-to-peer. She was on the phone for an hour and a half to get, I believe it was like approval for a surgery that was like already happened, that they already got approval for, but then all of a sudden it was denied. Like it's crazy. Like all insurance wants to do is deny. Okay. And so as an out of network provider, you really now need to say, what is my priority? Are my symptoms affecting my daily life enough that I'm, mentioning it to my medical providers? I'm talking about with family or friends, or like I'm just can't progress in my wellness or exercise programs because of these symptoms, or I just want to be a better version, optimal health for myself. If you're at that point, F insurance. It's totally fine if you ask the question, but be ready for the response of all of our out of network, all of our services are covered out of any out of network physical therapy benefit you may have as part of your plan. Okay. And if you don't have those, like, that's okay. This is your choice. But we are always very transparent of telling people what our evaluation price, what our treatment price is going to be. And it's a flat rate. That's the other thing they try to catch you on. They may say, oh yeah, we're in network and our cash price is this. If you haven't met your deductible, they will often give you the flat rate. And then depending on what treatment happens, then the price goes up. So you're like, wait a minute, I thought you were going to charge me only $125. How come I'm getting a bill for $300? Oh, because we threw in $50 for dry needling, $50 for the manual, $50 here, $25 there. Oh, you use this. And so that's how they mark it up. And because you didn't meet deductible, or because for whatever reason it was billed wrong and it was billed under cash, I'm telling you, like that is what happens. And so oftentimes I get people that like, we wish we should have just paid your fee because we knew what we were going to be getting every single time, no matter what we do. It's kind of a flat rate, da da da. Now, do I have those kind of financial conversations and people start telling me, hey, it's really hard for me to come in at this frequency? Totally get it. We sit down, we figure out a plan. We manage those expectations. So if I see somebody for like one time a week for a while, symptoms are going great, whatever, and they're like, look, it's starting to get, really hard, but I really, value this. Understood. What can you commit to? If that's every other week, if that's one time a month, what can you commit to? That way we can manage expectations. We know what we're going to be working on from session to session. And there we go. Totally fine. I'd much rather have somebody come in with consistency than be like all over the place. Okay. And so that is something that I talk about right from the get-go, because this is all for you. This is for the betterment of your pelvic health and lymphatic health, and not to just line pockets. And so sometimes people get confused of, oh, well, you're going to get like reimbursed if you're in network. I don't get reimbursed, right? I am part of like the overhead cost, right? So it's like some of like that rate goes to the building, goes to the utilities, goes to documentation, goes to, the aides, goes to the clinicians. So like, please know that your premiums that you're paying for your insurance is not going to the provider. It's going to the insurance company. Okay. And if a provider is in network with an insurance company, they know they're going to get the volume from the insurance company, but they're not going to get that payment. And we have to live and survive too, right? But I'd much rather have a few really good clients than all these clients like all at once. I'd rather be only treating one client for a full hour, hands-on, individualized care, than be split my attention amongst like 3 or 4 different clients all at the same time and only spending about 15 minutes with each one of them. But then I now have to document like a freaking novel, so the insurance company won't deny anything. Versus an out-of-network provider, I'm documenting what I absolutely need to document, what is actually clinically necessary, what was pertinent for that visit, and that's it. It's like time-sucking nonsense of documentation. I don't also need to sit there and every other visit do like a progress note. That's the other thing that insurance companies make the providers do. So much documentation for no reason. It is absurd. So we're getting rid of that headache by being an out-of-network provider. A lot of us do supply what's called a super bill. So a super bill is a very easy page, one page read typically, and it has all of our information. It has our tax ID, our EIN, our MPI number, the codes, all that stuff, what the price was, the address, everything. So you literally can take that super bill, submit that through your portal with your insurance company, or use that form and have their form and literally plug and play whatever data, send. Okay? So people are so lazy that they can't fill it out. Come on. That is ridiculous. In the world of convenience, you can submit a super bill. You can fill out a form. You do it for taxes, you can do it for your super bill. I do it personally for my own personal things. It is really not that difficult. Okay. And then it's up to, and then you submit to insurance and it goes off to their little land. But I don't have any expectation I'm going to get anything back. So people that do, it's like, you really don't know, because it's also up to who's behind the desk that day. How many times have you guys called up your insurance company and get 1,000 different answers, right? Asking the exact same question. It's like, yep, yeah, it's annoying. And it's annoying and it's absurd. So by me choosing to be an out-of-network provider, we are skipping over all of that headache. We're going right to the source. We're going right to you and providing the services that are appropriate to you in a holistic approach with no limitations. Here's the super bill with all information. So if you want to submit that, go for it. It's totally in your purview. And then that way, if anything is reimbursed, you get it directly, which is also awesome, because you also will get more than I ever would. Okay. It's not going through a whole bunch of intermediary steps by the time it gets to the provider. It goes right to you. So oftentimes my clients that do submit to that super bill, they get more money back than what I was getting as an in-network clinician. And that's some crazy shit. So not only you could potentially get 50, 60, 70, 80%, if not all of it, or you also then see maybe that amount got added, goes towards paying your deductible. Lovely, right? So you're getting through that. So that when there is a more like catastrophic potential event that may happen later on in the year, if you're not paying for that like hospital price, you're already in network because you met your deductible, right? So all this like insurance mumbo jumbo crap, it really needs to be simplified, and that's again a different soapbox for a different podcast for our healthcare system here. But I get very frustrated when people assume a lot, or they want me to look into their insurance. It's like, no, I'm a solo clinician here. I do not have a big, billing department or somebody like calling in to check out your benefits. And quite honestly, the practices that do, kudos to you, because that is a big time sucking nonsense that the subscriber to the insurance company should do that. Okay. Yes, I'm in healthcare, but I tell all of my clients, be your best advocate. Know what your benefits are. That's just common sense. Look up your benefits. A lot of them have online portals. You can look and see what your benefits are. Print out that pamphlet. When your HR gave you the big folder of what's included and what's not, look at it. See what it is, so you can make the best decision for yourself for your own healthcare. So people that just automatically just get enrolled in, oh yeah, everything's gonna be good, they now should be realizing that just because you have a bigger name, like company, like United, Aetna, Cigna, like those bigger names, right? Blue Cross Blue Shield, Anthem, like all that stuff. There are plans underneath that. Your individual plan dictates everything. So you need to know what that is for yourself. You should be doing that not just when you come and see me, but when you see the dentist, when you see your primary care physician, what labs are included, what labs aren't, what x-rays, what MRIs, like all that kind of crap. Like you should be your own advocate when it comes to your own healthcare, which means being knowledgeable what your insurance is covered. Okay, so I highly recommend homework for everybody. Know what the heck your insurance covers and doesn't cover. Know if there's out of network benefits. And I think that's really what people need to be like looking into, especially for like HSA or FSA stuff. Know your out of network benefits too. If you're able to do it, get them. And that helps for people like me when you see a more specialized person that can treat you holistically. The super vote can go towards that out of network benefit. That's lovely. Um, and then also for that, it's like we want to have this analogy, and I love this analogy or metaphor, or whatever it may be, of insurance. Think about your healthcare insurance being similar to your car insurance. So your car insurance takes care of like the catastrophic stuff, right? You're in an accident, the car is totaled, it gets evaluated, you get a check for the new car. There might be maybe God forbid some bodily injury, it covers that. There might be a little bit of a deductible, so you may have to pay that little deductible, and then everything else is covered. Like that's catastrophic, like accident, things like that, right? Does your car insurance pay for your oil changes? Does it pay for your tire rotation? Does it pay for like new tires because the old ones are bad? Does it pay for the windshield wipers, like replacements? Does it pay for like the headlamp, replacements? Does it pay for the car detailing to get it clean? No, you pay for that stuff out of pocket. Does it pay for any kind of performance enhancing things? Maybe you want to have like winter tires instead of, the all around purpose tires. Does it have like that better like muffler? I don't know all the car part stuff. You need to ask my husband, but you get my drift. There's a lot of out of pocket expenses to just have your car run, to just maintain it, to it's got to go in the shop to get some update or whatever. Insurance doesn't cover for that stuff. It covers the big piece like that, catastrophic things. That's kind of how insurance is. It pays for like maybe the majority of like hospitalizations and when you're sick and like that kind of quote unquote catastrophic stuff. But it's not necessarily meant to pay for all these other visits, right? Like acupuncturists, chiropractors, mental behavioral health stuff, other like rehab things. And so pelvic health and lymphatic health, unfortunately, are these two specialties that mean so freaking much, but they're not very well recognized yet within the insurance community. And so they're not covered. And so without, try not to be so upset with the insurance, or really don't be upset with the provider for the decision that they made. So that way they can better treat you. That's really what it is. I did it for a long time. I was in a network provider and I hated it. I hated the fact that I had to be like, I was spending more time documenting about our visit than doing the visit itself. And then having to do even more documentation once a month when like nothing much has changed because we haven't had the time to change it since the last time, because I don't spend a lot of time with you because I gotta go see 3 other people at the same time because we need the volume because we're not getting paid enough from the insurance company itself. So instead of being upset with all these providers being out of network, maybe now you understand the why behind it, because there's so much behind the scenes stuff that providers have to do, and insurance purposely does that so when providers won't do those things, so then they'll deny, so then they just pocket those premiums every single time. I've had people that are saying, screw this to like Medicare. I'd rather, like, instead of paying the $800 or $1,000 premium, I'd much rather pocket that, save that up. So when I do need to pay for the $70 compression legging, I can just pull right from that, So everybody's finances is different. This is not for like a financial lecture at all. It's just understanding why providers tend to go more out of network now, because of the headache that's associated with dealing and working with insurances. To what end? We much rather work with you, the client, individualized, not have any limitations from someone that doesn't understand your condition or what's going on with symptoms or any of that stuff. And in that way, then, if you want to submit for any reimbursement, you definitely can. But this way, you're getting the best treatment. It's more efficient and actually overall costs less to pay for my services than end up in the hospital. And yes, my services can do that. For example, if you're a pelvic health client, you have what's called pelvic pain, and I'm assessing you, and I'm realizing, wow, the hormonal changes have adjusted like the skin integrity. We may need to talk about potential vaginal estrogen or vaginal moisturizers to reduce your likelihood of those recurrent UTIs. Wow, we just saved you a boatload of money and time and energy and pain by just taking care of the skin integrity that's associated with your hormonal stuff. That may also help heal, and help resolve your pelvic pain symptom, rather than getting these recurrent antibiotics and UTIs that won't mean diddly shit because they're not touching your hormonal changes. And then also saves you a hospitalization for potential UTI going septic. I know that's a big what if situation, but that what if situation happens a lot. And if you are up and up with the research that Dr. Rachel Rubin and partners did this last calendar year to get the black box warning label off of vaginal estrogen, it is going to save billions of Medicare dollars from taking that black box warning label off, getting it to the clients so they can use it, so they can reduce their risk of being hospitalized, and reducing the cost of insurance, right? And all of that stuff. So all this is it's a little thing in a much bigger wheel of insurance mumbo jumbo. So when you call up a provider like myself, who's an out-of-network provider, there are reasons why, okay? And we will, again, paint the picture for you so you can make the best decision for yourself at the time. If you need to go in network, we totally understand. And we're going to refer you to people that we know that are in network, but we also know the limitations that they have and give you that advocacy that if your symptoms aren't getting better within a few visits, you come on back and let's get things going. And we will set realistic expectations of what your commitment is. What can you, commit to in terms of frequency? This is our recommendation of what can you commit to, and that will really help too, because all of this is for you. All of it. All of it is for you. Holistic care, no limitations, hands-on, one-on-one for up to a full hour. You just don't hear of that within network providers. And we don't want to poo-poo them, but we're poo-pooing the system behind it. Okay? We also get the question a lot of, well, then what about Medicare? Well, there are some of us that just flat out won't take Medicare. There are some of us that like to quote unquote live in the gray. So we say that all of our services are deemed under wellness services, and we provide a detailed receipt for tax purposes for your medical expenses for the year. So you're still getting the services that you deserve. And then you can also utilize that as kind of like a tax, write-off deductible kind of thing for your medical expenses. So there are clinicians that do that. And so that way, for those Medicare clients, we do understand there is typically a fixed income and everything. Some providers, some out-of-network providers are able to provide kind of like scholarships or like giveaways, or to do some maybe pro bono work or significant discounts, because they just set up their business model that it just works for everybody. So yes, out-of-network providers can be such a great resource, and more people are doing that because we're just sick of being dictated by insurance companies that know nothing about what we're doing, despite us trying to fight it and everything, that will go through all of my notes and just find something to deny, not necessarily to accept, but to deny. So if one word is off, if one little thing isn't there, or maybe is there that they don't like, they'll deny it when it doesn't make sense. And that's something that you shouldn't be subject to. So I will now come off my soapbox out of network stuff, but it's just been because it's the beginning, of the year after Q1, a lot of people, this is the reason that I get a lot. And so I highly suggest you please share this podcast with people. Feel free to comment, reach out if you have any further questions. I'd be more than happy to do a part 2 to this, but this is very much scratching the surface of out of network, in network, and the behind the scenes bullshit that providers have to deal with. And that's just surface stuff. I didn't get into all the nitty gritty details, believe me. But it's so much for really not effectively treating you the way that you deserve. And being out of network, there's a huge cloud that's lifted off of us that we can actually treat all the things. We don't have to sit there and do a different plan of care or discharge you and redo all this stuff. We don't have to do any of that. We don't have to do these periodic stupid progress notes or fill out handouts or sheets to your insurance company asking for more visits. I shouldn't be asking little mommy behind a desk for more visits for you. We should be determining that. Right? That's silly. So there are reasons why providers choose to be out of network, and the majority and the primary reason is for you to get good quality care. And that's what we want, and that's what we provide here in North Star Physical Therapy for pelvic health for any and all adult, as well as any lymphatic health thing for lymphedema, lipedema, and alike. So I hope this was educational. I hope some of it made sense. Be your own advocate with your insurance. Know your benefits. It is not on the provider to know that. It is not on the provider to submit the stuff for you. It is on you. So we give you that responsibility, but at least you know what you're getting. And in an out-of-network office, it is, a flat rate. You know exactly what you're getting, and it is good, individualized quality care, especially here at North Star Physical Therapy. If anybody is here in the Northern Virginia area, I also do virtual sessions too, so I'm more than happy to help folks out that way too. We can do all those things where you don't have limitations of insurance on us. So research your own stuff. Check out those out-of-network providers because they probably do a much better job, and they have the accessibility for you. So until next time, y'all.
Thank you all so much for listening to North Star Physical Therapy Podcast. Continue to follow me on Facebook or Instagram at Dr. Shirley North. Check out my website at www.northstardpt.com, or I encourage you to email me any other questions about these topics, and it can be featured at a future podcast at snorth@northstardpt.com. Again, thank you all so much, and thank you for letting North Star Physical Therapy be your guiding light to your optimal health.